Hi, my name is Randall A. Welcome back to the Infertility Channel. It's 20 days before Christmas. It's beginning to feel a lot like Christmas, and in the season of lights, I wanted to shed a little bit of light on hysteroscopy. If you go back a few episodes, we have one on hysteroscopy. It's called Surgery Without Incisions. And today, I wanted to talk about one central question that I get from my patients. Are we there yet? Now, speaking of Christmas and tying all this together, when I was a kid, we lived in Memphis, Tennessee, and we made the annual trek every Christmas to my grandparents' house in Miami, Florida. And every 3 miles, all along the way, my sister would say, "Dad, are we there yet? Are we there yet?" Ultimately, each trip he would say, "I will tell you when you're there." So today, I would like to tell you when you're there with respect to hysteroscopy. Now, a quick review. Hysteroscopy is where we take a little lighted tube, a little telescope, up inside of the uterus. It's through the cervix, so there are no incisions, no cutting, and we then remove things like fibroid or smooth muscle cell growths, polyps, which are fleshy overgrowths of the lining, scar tissue, or even birth defects of the uterus. Now, each of those problems can lead to infertility and repeat miscarriage. Polyps have to be of substantial size to do so, but the other ones certainly are associated with problems of conceiving and carrying a baby. So let's take a look here. These are the 3 wise women. And here we have a fibroid, a smooth muscle cell growth growing from the muscle into the cavity. And remember, fibroids are all about location. So this one could cause problems for conception and even miscarriage. Here's scar tissue. It's called Asherman Syndrome. Asherman Syndrome is where the lining has been gone in part or in whole, and the front and back walls are stuck together, and it's hard to conceive perhaps with problems like this. And then we have these polyps, these more superficial growths. I had a patient a few weeks ago who underwent surgery for Asherman Syndrome, or scarring in the uterus. And we tried to prevent scarring by placing a special balloon inside of the uterus to keep the front and back walls apart. And she asked at the post-operative visit, "Are we there yet? Can I use my new and improved uterus?" And I told her, let's wait for a couple of months. Now, there was an interesting study published recently of 163 women who underwent removal of the fibroid through hysteroscopy, or cutting of the scar tissue, or taking these polyps out. They also looked at so-called septa, or congenital birth defects, where there's a partition between the right and left halves of the uterus. And they asked the simple question, does scarring return? Is there scarring associated with hysteroscopy? And how soon is that scarring gone? So after the initial procedure, after the initial operation, they went back every 10 to 14 days, the same surgeon for every case, and they assessed scarring. And then they found out how long it was until the uterus was repaired and ready to go. So what the author of this study found was that 86% of the patients who had polyps removed were ready to go, ready to have a baby, ready to conceive at 1 month, but fewer than 1 in 5 of the patients who had one of these procedures was ready to go at 1 month. There was scarring in an overwhelming majority of patients who underwent removal of fibroids, or removal of septa, or removal of scar tissue, Asherman Syndrome. So what is the take-home message from this study? It turns out that after the initial procedure, the initial operation, it may be important to look again to remove scarring. It probably takes longer to use the uterus. It's longer to get there, if you will, after one of these procedures than after removing polyps. You can use the next cycle to conceive here, and you should probably wait 2 to 3 months after one of these procedures. A quick story, this happened just a few months ago. My patient was from Eastern Europe, and she had undergone an operative procedure on her uterus, taking out fibroids. And she was having a fair amount of nausea in the immediate post-op phase, and she went home, and a couple days later, she called and she told me, I didn't quite understand, she goes, "I'm having a lot of vomiting. I put these teeny candles up my boot, and nothing is happening." And so I didn't quite understand, so her husband got on the telephone, and I said, "She's putting candles up her rectum?" And he says, no, the suppositories are waxy, and she's calling those candles, and she's putting the candles up her boot. And so I told her, that's fine. I called another prescription for more candles, and she did famously. So those are not the kinds of candles you should be using in this season of lights. Thanks so much. We'll see you next week here on the Infertility Channel. Be sure to share this video with your friends and subscribe to catch all new episodes each week here on the Infertility Channel. Plus, follow us on Facebook and Twitter. I love hearing from you. Comment below or tell me what you want to see on future episodes by sending me an email to comments@infertilitychannel.org. Until next week,